What I like most about rural generalist training is the diversity and flexibility of training. I've been able to shift around my training priorities to what suits me, and I think that's a great benefit to my training pathway. I'm also really enthralled by the fact that I have no idea what's coming through my door next. So the day-to-day is really versatile. One of the most unexpected benefits of rural generalist training has actually been how the career pathway has propelled my career. Last year I was absolutely thrilled to be announced the 2019 Junior Doctor of the Year, and I was also selected as a finalist for the Australian and New Zealand Junior Doctor of the Year award. Rural generalism really gives you a platform to excel your interests in medicine and network with your fellow colleagues in the area of rural medicine. Many of my peers have mentioned that they sometimes fear about going rural. I certainly understand those fears. Most of them come from isolation from family and friends, but also the concept of not enough support. And while they're certainly right that sometimes living away from your family and friends can seem isolating, in fact, I have continued to move further and further away from the city of Melbourne, and I build new networks of friends and support networks, whether they work at the hospital or if they're in the community. And when it comes to clinical supports, whilst there might not be another doctor in my health service where I work, I have up to 8 visiting medical officer, rural generalist or rural GPs on call that I can call at any time if I ever need help, and will absolutely rush up to the hospital if I need help. I personally think that working rural comes with some huge benefits compared to metropolitan medicine. The benefits around seeing a huge diversity of patients. The second is that you can work at the absolute maximum of your scope. Some rural generalists I know work as endoscopists, anaesthetists and GP obstetricians. Whilst they're far and few in between, you can certainly practice to the end of your scope. The third biggest winner of rural practice over metropolitan practice is that you are often, as a junior doctor, working with hands-on one-on-one with senior colleagues, whether that be in the general practice or in the local health service. You have constant supervision and constant support, whereas sometimes you can feel more like a cog in a wheel in some other specialties or practicing in metropolitan medicine. The best parts of being in a smaller rural community are that almost everyone in the hospital knows who you are, everyone in the general practice knows who you are, and a lot of people in the community know who you are as well. So you can become a really powerful voice for the community and become involved in many of the community opportunities as well, at the RSL, at the YMCA, or even in local sports clubs.